Well, thank you guys for having me. I am Dr. Ben Gonzales, and this is Dr. G's Corner. I've recently been updating one of my most powerful lectures to physicians and nutritionists on diabetes, prediabetes, and insulin resistance. As I was updating the research on this subject, I came across some research on how CBD can help improve a diabetic and prediabetic state. Diabetes is the number 7 killer in the United States, and honestly, that is an understatement because diabetes and prediabetes actually plays a direct role in all chronic diseases and contributes directly to the top leading causes of death in the United States, with number 1 and 2 being heart disease and cancer. If you have any type of heart disease, respiratory disease, or have ever been diagnosed with cancer or stroke, it is 100% certain that prediabetes and a condition called insulin resistance played a direct role in developing those diseases. It turns out your body has a natural CBD system called the endocannabinoid system. This system is similar to and acts like your endocrine system. It acts like insulin, other hormones, and glucose with molecules called endocannabinoids that travel in your bloodstream and act on receptors all over your body. This system affects the balance of your health and improves healing from the damage of toxins, injury, and aging. Prediabetes and diabetes accelerates the aging by increasing inflammation and feeds injury. You age faster. You do not have to be a diabetic for this to happen. It starts early with increased blood sugar, even before a diagnosis of prediabetes. If you have ever been told you have prediabetes, it turns out studies have shown you are more likely a diabetic and have been for a while. In my clinic, if I suspect prediabetes, even if I feel is very early in the development, I am aggressive in managing and getting that monkey off the patient's back. Researchers have shown that CBD, that non-hallucinogenic molecule that comes from the cannabis plant, CBD, that molecule that your body has natural receptors for, is able to cut down blood sugar, increase insulin effectiveness, decrease inflammation, and improve overall healing processes. According to UCLA Health, and I quote, "We now know the endocannabinoid system is involved in a wide variety of processes, including pain, memory, mood, appetite, stress, sleep, metabolism, immune function, and reproductive function. Endocannabinoids are arguably one of the most widespread and versatile signaling molecules known to man," unquote. Honestly, I could stop right there in this discussion, and you would understand everything I would want to get across to anyone suffering from diabetes, prediabetes, and any other chronic disease process. CBD is not a cure. Rather, it is a bridge, a powerful and short bridge to improved health. A common thing I see in diabetics is nerve damage called neuropathy. That chronic pain in the legs, arms, hands, and gut that many diabetics suffer from. CBD helps in managing and healing such pain. So now, the top 4 things diabetic patients should consider if they want to try CBD for the first time. Number 1, do your research. Look up what I'm saying. Look at other angles and other experts discussing how to use CBD. Number 2, clear it with your doctor first. Most physicians do not understand this knowledge. Bring what I said, bring that research to your doctor. Number 3, use a full spectrum CBD. This ensures all the components that are involved with activating those healing receptors are being triggered. And number 4, experiment with the dosage. Start low at around 5 milligrams 2 times a day and go up from there. It may not work at first, but it is much better to start low and slow in order to find that sweet spot of health. Research reliable brands. Do not trust grocery store and gas station CBDs. So for more information about how to properly use and source CBD for diabetes, prediabetes, and insulin resistance, you can contact me directly on Instagram at BenGonzales_MD. That's BenGonzalez_MD. Or you can call the clinic and set up a telephone consultation with me at 301-622-2722. That's 301-622-2722, and say you heard me on this show. So hey guys, diabetes has been on the rapid rise in this country and the world for that matter. It's good to have a tool to help dig someone out of a hole. I hope that helped.
You know, the way you say it, it makes it so obvious that someone should be using CBD and everyone should be using it. Do you ever get any pushback from patients that say, hey, I don't want to do it for any reason?
Absolutely, get pushback all the time, and the pushback is usually because of the lack of knowledge of the basics. Understanding that CBD is not hallucinogenic. CBD is something naturally found in your body. The system is found naturally in your body, and those are the kind of the pushbacks. Or, on other drugs, my primary doctor is unsure. What can I do about that? And so we educate. Education is the number one way to get across to patients, and repetition. Repetition is my best friend.